Hello everyone, I'm Kenneth, your SciMate for today. For this video, we're gonna talk about one example of communicable disease. Zika virus. It is the virus in the viral family Flaviviridae. It is a positive sense single-stranded RNA virus, and it was originally discovered in rhesus monkey in Uganda, where the first recorded human cases occurred in 1952. So the previous outbreak of Zika virus have included the outbreak in the Yap Islands of Micronesia in 2007. In 2013 to 2014, the French Polynesian had outbreak of Zika virus as well, and many of the populations are affected. 2015 to 2016, the South America and Caribbeans where the Zika virus occurred. The Zika virus transmitted by a mosquito bite, Aedes aegypti, the same mosquito that transmit dengue fever and yellow fever, and it can also be transmitted by Aedes albopictus. Aedes mosquitoes usually bite during the day, early in the morning hours, late afternoon hours, and evening. Zika virus is also transmitted through sexual contact, transfusion of blood, organ transplantations, and the transmission between mother and fetus during pregnancy. The virus can be transmitted from mother to fetus during pregnancy, resulting microcephaly, or the smaller size of head than its normal size, and other congenital disorder and malformations in the infant, or what we call congenital Zika syndrome. Microcephaly is caused by underlying abnormal brain development or loss of brain tissue. Congenital Zika syndrome includes other malformations including limb contractures, high muscle tone, eye abnormalities, and hearing loss. The incubation period, or the time from exposure to symptoms of Zika virus disease, is estimated to be 3 to 14 days. The majority of people infected with Zika virus do not develop symptoms. The symptoms are generally mild, including fever, rash, conjunctivitis, muscle and joint pain, malaise, and headache that usually last for 2 to 7 days. The best protection from Zika virus is preventing the mosquito bites indoors and outdoors, especially from sunrise to sunset when mosquitoes are most active. Some personal protective measures include wearing long-sleeve shirts and long tossers, using physical barriers such as window screen, applying insect or mosquito repellent to skin. For young children and pregnant women, they should sleep under mosquito net, especially during day or early evening. In school, around homes, and work sites, it is important to eliminate these mosquito breeding sites, including covering water storage containers, removing standing water in flower pot, and cleaning up trash and used tires. The health authorities may also advise use of larvicides and insecticides to reduce mosquito populations and disease spread. According to World Health Organization, the infection of Zika virus may be suspected based on symptoms of a person living in or visiting areas with Zika virus transmissions and by the bite of Aedes aegypti vectors. So a diagnosis of this infection, the Zika virus infections, can only be confirmed by laboratory tests of blood and other body fluids such as urine and semen. There is no treatment available for Zika virus infections or its associated disease. The persons who develop symptoms of Zika virus infection should seek medical attention to laboratory testing and other clinical care.